Hi everybody, welcome back to the Dr. Sia channel. In this video here today, we're going to be talking about the third reason why your therapy didn't work out for you. So, let's get started. Alright, so the third reason why your therapy didn't work out for you, there's the lens. The third reason why your therapy didn't work out for you is because projection was active. So what does that mean, projection was active? A lot of ISTDP therapists will be talking about projection was active. It essentially means that you had some idea about your therapist that was not true about your therapist, but was rather true about people in your past. So, in essence, it means you sat down and because you've been judged in the past, you expected to be judged by your therapist. Because you've been beaten up in the past, you expected to be beaten up by your therapist. Because you've been manipulated in the past, you expected to be manipulated by your therapist. Because you've been cheated on in the past, you expected to be fooled by your therapist. Because you've been abandoned in the past, you expected to be abandoned by your therapist. Now, this is called projection, that essentially you sit down and you know nothing about a new person, you know nothing about them, you've never met them before, but just by sitting down, you sort of copy-paste your past onto the therapist. Now, of course, a really good therapist, their job is to let you know that this is happening, that some part of your mind is automatically copy-pasting your past onto them. And in doing so, there's going to be big issues like trust issues and lack of collaboration issues and an inability to work together type issues. Now, if that is happening and your therapist does not see that, is not able to pick that up, is not competent enough to pick that up, and check my other video on competence, then they won't be able to help you overcome those issues of trust. So say, for example, that you think to yourself, as long as this guy looks like this, as long as his eyes look like this, he's probably judging me. He's probably thinking really bad things about me because everyone that I know in my past, their eyes looked like that, then they were judging me. And now, so I might be like really confused as you come into therapy and I'm like doing this a lot and thinking a lot and you might go, oh, he's judging me. Now, unless I'm able to identify that idea that you have in your mind that I'm judging you, I'll be doing this a lot and then two things could happen. Is one, you don't come back, or I just severely prolong the amount of time it takes for you to feel at ease with me to learn that I'm not actually judging you. So what do we then do as therapists? What do we need to be able to do? We need to be able to identify that projection is active so that we can help our patients see that they are sort of copy-pasting their past onto us so that we can look at that together and deal with that so that we can have a trusting, working relationship. Now, when therapists don't, when they're not able to identify that, basically the only thing that could happen is that either it prolongs therapy a whole lot until you feel like you can actually trust that therapist, or you never really do. You never really get over that issue, that idea that you can't trust them, that you think that they're going to judge you, that you think they're not on your side. And as that's happening, therapy is going to be ultimately useless to you. I mean, I saw this talk, or I heard this talk by John Fredrickson not long ago saying that in, for example, substance use and rehab settings, 90% of the patients are in projection. They're not even actually working with the people in the rehab setting. They're not actually there with the people who are there. They're just bringing all of these past people with them into that rehab setting. And, there's no way that's going to be useful for you. Similarly, if you go to therapy and your idea is that your therapist is going to judge you, somehow hurt you, or abandon you, or criticize you, no way is that going to be useful therapy. So if you're a patient and watching this and you have issues like that, you're having barriers like that in your therapy, you need to tell your therapist. You need to go and say, I actually think that you're judging me and I think that you're being judgmental. And then you can look at that together. If you're a therapist and you're not dealing with projection, you're not actually actively getting in on projection when it happens, then what you're going to find is that you're either prolonging therapy by a massive amount, or that what you're doing is you're actually causing harm. You're actually causing harm by not even giving your patient the opportunity, the chance to deal with their projection with you. You're sort of sitting there, accepting that there's this undercurrent of distrust that you're going to disprove somehow by being really loyal and being really reliable and really showing more and more interest in the patient, and sort of by thinking that you can empathize that stuff away. Well, often we cannot, because when we know that when it comes to a sort of avoidant, ambivalent, and disorganized attachments, they don't deal well with ambiguities. They don't deal well with you trying to do something onto them without you letting them know what you're trying to do. So at the very least, if you don't want to deal with the projection and you do identify that they're perhaps thinking that you're critical towards them, at the very least what you need to do, if you're not going to address it directly, is to let them know, just so you know, I think that you're thinking that I'm criticizing you, and I'm going to sort of in a manipulative way use my empathy to sort of reduce that in some sort of method that I use to inadvertently deal with this huge issue of projection. Which, and you can hear from what it sounds like with what I'm saying, I don't like that method. I think it's unethical. I think it's manipulative. And I think a lot of people have adverse reactions to us trying to do things to patients without letting them know what we're trying to do to them. And what do you think as a patient, from being from the side as a patient, do you think it's our responsibility as therapists to let you know what it is that we're trying to do? Or do you think that it's our responsibility to try to manipulate you out of your suspiciousness or manipulate you out of your paranoia by sort of, if you will, or your projections or whatever else is going on, to sort of remove you out of your copy pasting without you knowing that that's what we're trying to do? I think we should be letting you know what we're trying to do. And if we didn't identify the projection, then therapy is just going to be useless and it's going to fail for you. And if we can't have an open conversation about what is actually happening in that moment here together, there's projection happening, let's do something about that together. Let's see if there's any evidence for it. Let's see if it's reality, if my eyebrows actually suggest judgment, or if it's just some people in your past. Let's see if we can do something about that. And if that's not what therapy looks like when projection is active, like I said, it's just going to go on forever, or it's just going to be useless and you're going to end up dropping out. So let's not do that. Let's have a conversation with our therapist. And if you are a therapist, start having more open conversations with your patients as well. I hope you enjoyed the video. I hope you don't freak out. I hope it's not too confrontational. But hey, you can't talk about the topic of why therapy failed without it being a bit confrontational to somebody. Because either, somebody failed something. Anyway, press that bell button, subscribe, let me know what you think, and I look forward to seeing you again next time.